is Academic James, a 200 level healthcare management/nursing student of the Jpts Institution Management Science and Technology in collaboration with the South American University USA, Global Wealth University, Togo, Makodi Center precisely. I'll be presenting a seminar topic on perceived socio-cultural factors influencing nutritional status of children below 5 years in selected rural communities. Child nutrition plays a key role in child and infant health and death. Young children, pregnant women, and nursing mothers are the nutritional most vulnerable in the society, and little is done to help achieve their nutritional need. Factors that affect malnutrition in our societies are: one, lack of money. In the society whereby there is lack of money in a family, it is a fact that the family will not be able to cater for the need of the children nutrition, and it affects their nutritional need and status of the children. And also it have many effects on them by causing them diarrhea and infections and many other things, etc. These factors combined with other factors such as family structure, ignorance, illiteracy, and poverty can lead to severe malnutrition. Malnutrition in children. It is important to identify and understand factors that put children from rural community at greater risk of malnutrition and early childhood compared to all urban counterparts. This present study aims at identifying the socio-cultural factors that influence malnutrition in children under 5 years. This study was carried out to assess the socio-cultural factors influencing nutritional status of children below 5 years in selected rural community in Enugu State. The objective of the study were to determine the influence of family structure, socio-economic status of the family, maternal education on nutritional status of children, and to identify religious and cultural practices. Yes, this study is carried out for them to know and to understand the structure of the family, the socio-economics, how well financed they are, and also to know the education of the mother towards their children nutritional health, and how to feed them, on how to grow effectively and healthy and sound. In conclusion, all the variable family structure, socio-economic status, certain religious and cultural practices were all perceived to have a negative influence on the nutritional status of children. Maternal education also has a very vital, important, strong influence on the national status of children, and educated mother had less number of children malnourished. Yes, when the mother is educated, she knows how to feed her children in a well-balanced diet food to make them not to be malnourished. But when they are not educated, they don't know the amount of things or food to give to their children to make them to be well balanced. So it is recommended that healthcare personnel should educate mothers on factors that lead to poor nutritional status. Mothers have to be aware, they have to be taught on things that their awareness have to be created for them, so that they will have the knowledge of how to feed their children so that they will not be malnourished. Women empowerment through educational should be encouraged, as it promise family finance, better food security, and better household nutrition. When a woman is educated and empowered about how to manage her food, how to balance the diet of her children and her family. It made us to understand that the everything is properly put in order and there will be better household nutrition. Thanks.